the minimally invasive procedures to treat varicose veins are based on the ultrasound findings. So a patient that comes for evaluation in our clinic will initially get what's called a duplex ultrasound, which is a very detailed ultrasound measuring the size of the veins, measuring the extent of the reflux, how extensive the blood is pooling in the veins. And once the patient gets mapped out, then we go through a thorough history and physical and examination, and then a treatment plan is generated to treat the procedures in the office. And all of this is relayed to the insurance company, who will approve the procedures ahead of time, so that there's no problem with taking care of the costs associated with the procedures. And because we're an extensive vein center, we know what the requirements are from the various carriers. So we do provide the information that they want, so that they will approve the procedures in a timely fashion, so that you can move on with the procedures and get them done in a timely fashion. The procedures are done in the office. They're done under local anesthetic, no sedation. Patients drive in and drive home. I have patients who do it on their lunch hour, and the treatments range from shutting down the veins with various techniques to actually removing the veins, some of the veins in the office. So we start off with treating the underlying deeper refluxing veins, and that's usually done with ultrasound guidance. And initially, the treatments required heat, which is a very good technique. Either radio frequency or laser is used to provide the heat to basically seal the vein shut. And those are excellent techniques. We've sort of come along over the years to treatments that don't require heat, because if you use heat, you do need to anesthetize the vein a bit, which is not a big deal, but it's a series of little lidocaine injections. Now there are techniques which use glue, and there are also techniques that use chemicals. So the glue technique, which is called the VenaSeal, that's the trade name. It's basically cyanoacrylate glue, and this is injected into the vein under local anesthetic. So it's a single puncture through the skin into the vein, and the glue is instilled into the vein, and it just hardens and solidifies the vein. And it's a very gentle technique. The closure rates are similar to the thermal techniques, and it's minimal discomfort post-procedure. The other procedure that we use to take care of the deeper veins is using a detergent called polydocanol, and the trade name is Varithena. And basically we inject the Varithena into the vein, and that as a chemical will shut down the vein. So the techniques we choose are based on insurance, whatever the insurance company will allow, and also the anatomy, patient preference, and where the vein is and how visible it is. And then ultimately, if varicosities are still prominent, simple procedure of just numbing up the skin, making a tiny little incision, and actually extracting the vein is a very doable technique in the office, which is very well tolerated. After these techniques, the blood is rerouted to other veins. So there's no, even though most of the veins that we treat are sort of the main veins of the legs, the patients have to realize that these veins are bad veins. They're not functioning well. They're problem veins, and so shutting them down is a good thing. And most patients think, well, shutting down a major vein is a major problem. No, shutting down a defective major vein is a good thing to do. And then the network of veins is phenomenal. The veins just migrate through other veins, reroute themselves out through other smaller into larger veins, and ultimately out the leg into the pelvis and back to the heart.